All right, let's jump right in. Today, we're going to talk about something called transcranial magnetic stimulation, or TMS for short. Think of it as a whole new playbook for tackling depression and OCD, especially for those times when the usual treatments just aren't cutting it.
I mean, it's just so frustrating, isn't it? You feel like you're doing everything you're supposed to. You've tried antidepressants, you've put in the hours in therapy, but you're still feeling stuck. That's a really tough spot to be in, and for so many people, it can honestly feel like you've hit a dead end.
But what if there is another way? You know, a path that doesn't rely on medication and one that's actually backed by some serious science. Well, there is, and that's exactly what we're going to get into right now. Okay, so this different approach we're talking about, it's called transcranial magnetic stimulation, or TMS. This is a therapy that has been a real game changer for people all over the world, especially for those who felt like they'd run out of road with other treatments.
So, what in the world is it? Well, the first thing to know is that TMS is not a drug at all. It's more like physical therapy for your brain. It's fully FDA approved, and what it does is use these super targeted magnetic fields to gently stimulate the exact parts of your brain that handle your mood.
And you know, the real appeal of TMS starts to click when you look at what the experience is actually like. First off, it's not invasive. That means nothing actually enters your body. It's also pain-free, and you don't need any anesthesia or sedation, so you're totally awake and alert the whole time. And maybe the best part for your day-to-day life, as soon as your session's over, you can just get up and get right back to your day. Okay, so we know it uses magnetic pulses, but how does that actually help? Like, what's really going on inside your brain? To get that, we've got to peek under the hood at the science. The whole process is actually pretty fascinating and surprisingly straightforward. So a special device is placed on your head, and it sends these really precise magnetic pulses to one specific spot, your prefrontal cortex. Now, in conditions like depression and OCD, the brain cells, the neurons in that area, can get kind of sluggish or underactive. The magnetic energy from TMS acts like a gentle wake-up call, nudging those sleepy brain cells back into action. It's almost like a soft reset for your brain's mood control center. Now, it's really important to get this. TMS isn't a one-and-done kind of thing. It's a full course of therapy. A typical treatment plan usually runs about 4 to 6 weeks, with sessions pretty much every day. And that repetition is absolutely key, because the benefits are cumulative. Each session kind of builds on the one before it, creating these gradual but lasting changes in your brain activity. All right, the science is cool, for sure, but what does it actually feel like to be the person sitting in that chair? Let's talk about what a session is really like, from a patient's point of view. You might be surprised to hear the sessions are pretty short, usually just 20 to 40 minutes. You're just sitting comfortably in a chair the whole time. And since you're awake and alert, you can do whatever you want, really. Listen to music, watch a show, or just chill out and relax. It's designed to slot right into your daily routine without causing a huge disruption. So the big question, what do you actually feel? Most people say it's like a light tapping or clicking right on their scalp where the device is. And while that feeling can be a little strange at first, almost everyone agrees that it's not painful. Yeah, in fact, here's how one provider puts it, which I think sums it up perfectly. Most clients describe the process as mildly unusual at first, but soon find it relaxing and routine. And that really hits the nail on the head. It's this initially new sensation that pretty quickly just becomes a familiar, and for many, a pretty calming part of their day. Okay, this is a huge question, maybe the most important one. TMS is an amazing tool, but let's be clear, it's not for everybody. So how do you figure out if it might be right for you? So who's the ideal person for this therapy? Well, TMS is often a great fit for adults who've already been down the road with other treatments. You know, antidepressants or therapy, and just haven't gotten the results they were hoping for. It's also a fantastic option for anyone who wants a drug-free approach, or for people who just can't handle the side effects that can come with medication. So yeah, there's a pretty clear line here between who's a good candidate and who isn't. On the one hand, it's perfect if you're looking for a structured, evidence-based treatment that doesn't involve medication. But on the other hand, safety is everything. Since TMS uses powerful magnets, anyone with metal implants in or near their head just can't do it. And likewise, if you have a history of seizures, it's not an option, because the whole point is to stimulate brain activity. And to make absolutely sure it's safe, you don't just walk in and start a session. The process always begins with a really thorough psychiatric and medical evaluation. That first step is non-negotiable. because it confirms that TMS is not only right for your condition, but that it's physically safe for you to undergo.
So, when you take a step back and look at the whole picture, what does TMS really stand for? Well, for a lot of people who have felt completely stuck on their mental health journey, it really does represent a brand new possibility.
Look, at the end of the day, TMS isn't pitched as some kind of magic bullet, but it is a real, legitimate chance for significant relief from your symptoms. It's a therapy that's deeply rooted in brain science, and it's delivered with a lot of structure and compassionate care. For so many, it's become a powerful new tool in their wellness toolkit. And that really brings us right here to the final thought. If you're someone who feels like you've tried everything, if you're searching for a different way to manage depression or OCD, I hope this little explainer has shined a light on another path you can explore. So the question to leave you with is, could this be that new path for you?